April Hicklesell or April Humbarger.
Yesterday afternoon, Judge Barker from the U.S. District Court in Southern Indiana handed down an injunction against some of Indiana's laws that regulate abortion. A couple of those things that she put an injunction against, so effectively stopped, are things like saying that it has to be a doctor who prescribes the abortion pill. It cannot be anybody else. Or that a doctor actually has to see the woman and meet with her before he prescribes an abortion pill. So these different things that have now been stopped, these laws that have effectively been canceled out by Judge Barker's injunction, are really worrisome, I know, for me, Dr. Mullally, because I see women's health being at risk. Another one is that surgical procedure rooms had to be a certain size, in part to be able to fit a gurney through the door if the woman had an issue during the abortion. And now that's been struck down by this as well. So as a physician, especially one who I know cares a lot about his patients, are there things that worry you? What do you see as being the biggest problems with this injunction that Judge Barker has put against our Indiana laws?
Yeah, I was shocked by a lot of the things that were, enjoined through that ruling. I got to do a lot of telehealth as part of the coronavirus pandemic.
Yeah.
And it is not the same as seeing a person in the office. And it's one thing if you need a refill on your blood pressure medicine and you can give me readings over the computer.
Sure.
It's a very different thing if there's a patient who is coming, who you've not met before, and just says, I want an abortion, and you do that over the computer.
Mm-hmm.
That is substandard medical care, and it's really kind of the Wild West. It's not like there's a process out there to make sure that it's being done well. I was shocked that they got rid of the importance of counseling and the requirement to counsel people. All medical providers focus on the importance of informed consent so that before a patient undergoes any procedure, takes any medicine, they know what they're dealing with. If you're not counseling the patient about that, that is apart from the normal standard medical care. They got rid of the physical exam, so this can be done totally over a computer.
Yeah.
And then they also got rid of several other things regarding the abortion industry. And so to me, I saw this and I said that this is a carve out for abortion so that they don't have to do stuff that we would do for ear infections or hernia surgeries or anything else.
Yeah.
And so in my mind, it's very unsafe, and I can only hope that the appeals process will bring safety back to these patients.
One thing that immediately came to my mind was ectopic pregnancies.
Yeah.
So before we put women on birth control, we do a pregnancy test to make sure that that's not in play so that they're not injured and that a child isn't injured. For the abortion pill, we should be checking for ectopic pregnancies because it doesn't affect those the same. And if ectopic pregnancies go on, we could have ruptures and then women die at high rates.
Yeah.
And so that was the first thing that came to my mind is this could potentially kill women because they're not getting all of the checks that need to be done before an abortion happens.
Well, not only the medical checks, obviously it's substandard medical care, but even socially, the social checks. How do you know that this woman's not being coerced into this? I have the opportunity, and I got to recently talk to people who are survivors of the sex slavery trafficking rings, and you hear them and the coercion for even going to seek out medical care. When you're on the other side of the computer screen, who's in the room with the patient forcing them to do this?
Right, telling them what to say.
So it's not safe medically, and it's not safe socially or ethically either.
Thanks for your comments. We appreciate it. And I know the Catholic Medical Guilds will be putting out a statement soon.
Yes.
That talks about more of this and in more detail, so we can be looking for that as well. And we're going to be at Right to Life of Northeast Indiana interviewing more people who have expertise in these areas and can tell us why these injunctions are problematic. And we'll also be putting out what you guys can do to help put pressure, maybe not quite on Judge Barker, but on the system to be able to correct some of these, because these are really truly about keeping women safe, and that's not happening. And I'm worried that we're going to see more and more of them in the emergency room.
Yeah, nobody comes to an abortion and they're excited about it.
Right.
So all of the ladies are victims as well, and right now they're the ones who are really being totally disregarded by removing all of these things that are put in there for their safety. So hopefully this can be overturned soon. Until then, we have a lot to pray about and hopefully work for.
Sure, and we covet those prayers. Thanks, guys. See you later.